Well, hello and welcome to the Small Business Briefing. Welcome. Glad to have you here, and wanted to maybe start something new, just a little bit of a preview of the things that we're going to be covering today. So, of course, today's Monday, it'll be Data Monday. We're going to look at several things. We're going to talk about some changes and some complications in the numbers that hospitalizations, the hospitalization trend lines. So much has changed now. It's becoming a little bit more difficult to tell what's happening with respect to serious reactions to COVID because of some shortcomings in the data. And then we're going to talk about the Supreme Court, of course. I binge watched the Supreme Court, or listened actually to the Supreme Court hearings over the weekend and Friday, and some insights and some, maybe we'll talk about what I expect to happen. So we're thrilled to have you here for briefing number 228. As usual, my co-host today is Sarah Miller. Sarah, how you doing?
I'm good, and I want to say thank you for binge watching the Supreme Court hearings so that the rest of us didn't have to. That's very kind of you. So welcome, friends. Today we're on show 228, and we are sponsored by Marana Group. Marana Group is a data, document, and distribution solutions company, and they offer a full line of solutions designed to get your company's message into the right hands in a timely and cost-effective manner. So we use Marana Group. They have the best customer service, and you can learn more about them at maranagroup.com. So, Brian, I maybe didn't binge watch the Supreme Court arguments, but I did pay a little bit of attention to the news, especially Friday's numbers. I know we continue to climb here. So it's Data Monday, and let's dive into the latest.
Very good. Well, let's go ahead and take a look at the graphs, and we'll start with the heat map. Now, the heat map itself is getting to, it's getting to the point where it doesn't really provide much insight. It's getting darker all over the place. And so this is the effect of Omicron, much more infectious. And there's a lot of testing that happens now. Testing overall is quite high, pretty much, frankly, at capacity. One of the things we're very concerned about the Supreme Court decision, which is a vaccine and testing mandate. There's not really a lot of extra capacity sitting out there for testing right now, but you see numbers that are rising quite a bit all the way across the country. There aren't too many places that aren't at that hot spot type of a level. Looking at some of the graphs around the country, you'll see that some of them are getting so high as a percentage of last winter's peak, and that's what's being shown here for some select states. How much in terms of a percentage are these states above last winter's peak when you talk about infections? And you see that some of them are kind of off the charts. Looking at these, Rhode Island and New York, and so some of the earlier ones that went up really fast and early in New York and in DC. There's some signs, there's maybe some late reporting here, but there's some signs that maybe they're starting to crest. Maybe the increases are starting to finally slow down in those areas. So we'll take a closer look at New York here at the end of this presentation. Want to take a look at the nation as a whole. So you see that we look at the heat map, that's one representation of it. Look at the nation as a whole, and you see that in terms of caseload, it's extraordinarily high right now. And here's the thing is that I've seen some estimates that the actual caseload, because most people have a much less severe result or set of symptoms as compared to COVID of previous strains, that these identified cases probably don't make up the vast majority of them. In fact, I've seen some suggestions that maybe only 10% of actual cases are being diagnosed right now because many people have a much less severe reaction and wouldn't even think to go get a test. The hospitalizations you see overall on the rise. We'll talk a little bit about it and coming up here, but why this number is become much more problematic to show the severity of the disease as compared to previous waves. But as you can see, nationwide overall hospitalizations going up. These are Michigan's numbers. And you see that very clearly. We transitioned. We never really came down much from the Delta crest, which is what we saw here. So Delta started going down. In the meantime, though, we can be assured that at some point during this, late December, that Omicron took over, and then you see numbers going to a new high. It's new enough here in Michigan to where I don't think that we're close to the top of this particular wave. And you see hospitalizations that were coming down that turn around and went right back up. Again, one of the challenges that we're going to see in hospitalizations is that they test pretty much everybody who goes into the hospital now, no matter what you came in for. A lot of people go into the hospital for one thing and find out that they have COVID because you got to test it when you went in the hospital, but maybe didn't even know it and are certainly not there for it. Looking at deaths again here in Michigan, you'll see that number is pretty, over the last couple of weeks anyway, has come down or leveled off. And I think that just the law of large numbers, though, is going to kick in, that Omicron gets to so many people that even though a smaller percentage of them have severe reactions, you will see more serious cases because there are just so many people. It's getting to the vulnerable populations more. This is New York, and I thought this would be a good one to show this week because New York is a little ahead of us in terms of their reaction. And so you see this number as it climbs. You see it's not quite as steep here in the last week of an increase, and usually that is what happens before it starts to crest and level off. So I'm watching this. I'm watching New York pretty closely to try and get a sense for how fast it's going to move through the population here in Michigan. You see hospitalizations that have risen as well. Now, this data does not include a change that New York has made in their hospitalization data that I hope catches on nationwide, because I think it's an important distinction. Remind me, Sarah, to cover that once we get through this presentation. But hospitals are still under a lot of strain, regardless of why somebody came into the hospital. If they have COVID, they have to be isolated in the hospital, and so the way that they staff the hospital and the where they place people and how they manage COVID cases, even if they're not in for COVID, is much more expensive and difficult, especially in a time when staff is they're so challenged to staff up hospitals. And then here's deaths reported by day, the 7-day average in New York. And as you can see, the very beginning of the pandemic, you might recall that's when Michigan had its darkest days as well in terms of the severity. We had a lot of hospitalization and COVID cases. Couldn't really identify all the cases because they weren't testing, but showing up in hospitals. And same for New York. Now, as a percentage of the total in the cases, you can see that deaths clearly are rising in New York, but given the height of the cases, that they're 400% or 500% of the previous winter peak, that'll tell you that the average experience by any individual person is about what we would have expected based on the results in other countries that experienced COVID or experienced Omicron before the U.S. And then I liked these charts mainly because it's comparing with a 21-day lag. This over here on the left-hand side, cases as of December 18th um, had reached a point about 75% of last winter's peak, and then overall you'll see deaths lagging somewhat behind, but as a percentage lower than last year. But it shows us that lag, 21 days. So our case level today, 3 weeks from now, we'll know what the most serious outcomes are in terms of deaths. So there is still a delay, and I would caution people not to be too cocky about saying, well, deaths aren't going up the same as even though the cases are way up. But 3 weeks later is when we'll know the full picture. And then in terms of hospitalizations, it's right now the cases in New York are maybe 500% higher than last year's peak. Overall hospitalizations are about 150%. ICU is lower than that, and those on ventilators in ICUs are still lower. So everything still points to the fact that the individual case, any individual's risk with respect to Omicron is lower than, say, with Delta, but it's getting to way more people. And so you're seeing it show up in a lot of different ways. Also, just to reiterate or underscore that when it comes to hospitalizations, the vaccinations still provide a lot of protection. And so those that are actually hospitalized with the vaccine make up a minority of the overall cases. So I wanted to show New York for a couple of reasons. First is that they maybe give us an idea of our own timing coming up in the future, because right now I know employers are dealing with really serious ramifications on who can show up for work. So a lot of exposures, a lot of COVID positive cases, people that aren't seriously ill but still can't come into work. And so how long is this going to last? And how long are we going to be dealing with this, and employers dealing with this here in our state? But also in New York, we can get an idea of what the lag is going to be in terms of hospitalizations and death as well, which frankly looks pretty similar to what we've seen in previous waves.
So let's talk about hospitalizations again. I know that there's a lot of headlines out there, hospitalizations are rising again, or they'll take specific population segments and dive into those, especially with kids. But I was reading a little bit this weekend that we need to be careful about understanding hospitalized with COVID and hospitalized because of COVID. And I think, you did touch on that, but tell us what New York is doing to kind of combat that data.
As far as I know, New York is the first state to separate out their hospitalizations and report them in this way. So when we're looking at data on hospitalizations in Michigan, for example, it's everybody who is both in a hospital and has COVID. Well, there are many people that I might go into the hospital for a knee surgery, and they test you because you go into the hospital, they have to test you, and they find out you have COVID. I'm going to be in the hospital for a couple of days for that surgery, and I'm a person who has COVID and is hospitalized. So in Michigan, our data is all put together. We don't really know how many of them are hospitalized because of COVID. Now, New York started keeping track of this, and late last week they published the first set of numbers, and I don't know how representative it will be for the rest of the country, but what they showed was that statewide, 43% of those hospitalized with COVID was not one of the reasons for admission to the hospital. So 43%. So if you look at their hospitalization number, about 43% of it are people that were just found to have COVID when they went to the hospital for another reason. In the city of New York, so they have the stats for the whole state, and the city of New York is even higher, 51% of the cases in New York City hospitals that were COVID positive. COVID was not one of the reasons listed for admission. Now, a couple things to keep in mind. First of all, I think that it helps clarify why, we're still confident that Omicron is not going to lead to as many people having a serious reaction to it, serious set of symptoms, hospitalization and death, and yet the hospitalization numbers are still really high. It's just because this is spreading far and wide, and the law of large numbers is kicking in, and people going into the hospital is representative of the population, and therefore, you're going to see non-COVID admissions start to impact the overall COVID hospitalization numbers. So, but that doesn't mean that it's not still a problem. When a person goes into the hospital for a reason that is not related to COVID, but is found to have COVID, it has two really important impacts that make it difficult on the hospital and their ability to provide healthcare. First is it's exposing the staff. When the staff's COVID positive, then they have to be out, and so for a period of time. So the idea that there's already staffing shortages in hospitals that do impact the quality of care. The fact that Omicron is more present in hospitals today is problematic because it can really hurt the number of staff or spread within the hospital to other vulnerable populations. And so that's a pretty difficult scenario for them to manage through, because not only are they struggling with staff, but they also have to ensure that the disease doesn't spread within the hospital to other populations that would naturally be more vulnerable. So you're going to have older people in the hospital, for example. You're going to have people that are dealing with issues with hypertension and diabetes and these different risk factors to cancer treatments. So they could have scenarios where an infection, if they got an infection at the hospital, that it's more likely to lead to one of these cases that is more serious. So that makes it difficult to know exactly what's happening with the severity of the population getting COVID, because right now they're all just grouped together. I have no idea what the prospects are of the states and hospitals separating those out. I don't know if that's a complicated process or an easy process. I just know that New York did it, and it was quite insightful. And it is my hope that the data will be separated here in the meantime.
Well, it's certainly something we will continue to follow. Let's switch gears and let's talk about the Supreme Court. There are two cases in front of the court currently. Let's talk about OSHA's, and what did you learn during your binge watching of the proceedings this weekend?
It wasn't as boring as it might sound to listen to the Supreme Court justice. Actually, the first time that I had really listened through like C-SPAN and the court itself. Sometimes it's hard to know who you're listening to in terms of doing the talking. Some of the services will show that with a bit of a delay, but the whole thing was broadcast from start to finish, and looking at two main cases that we're kind of thinking of all together, but they're two different cases. There's the suit against OSHA, which is the 100 employee and above testing and vaccine mandate, and then there's the CMS rules on healthcare workers. So on OSHA, I really came away from it thinking that the majority of the Supreme Court is very skeptical that the federal government has the authority to mandate vaccines and testing and essentially conditions of employment in this way. I had no question at all that Justices Alito, Thomas, and Gorsuch were going to be essentially opposed to the Supreme Court's or to the federal government's use of OSHA in this way. I was less certain about the new justices, Kavanaugh and Barrett, and then of course John Roberts, who has really been kind of a swing vote. It's kind of hard to nail down his overall philosophy. I felt that all six of those that I just mentioned, that Roberts and Kavanaugh and Barrett, along with Alito, Thomas, and Gorsuch, that they were all very skeptical. I would not be surprised to see them come away from this with curtailing or maybe completely finding against OSHA. I was hopeful we might have an answer yet today, or at least a stay. That has not happened yet, but I wouldn't be surprised if it were 6-3 against OSHA's authority to be able to do this. And really what it came down to was a simple question: show me in the statute where the federal government in this particular department has the authority to do that. And time again, the answer was, it's inferred. It's kind of indirectly stated by, this means this in our world, this is a deadly virus, therefore. But really, when it comes to court, the thing I like about it being in court is that it's not emotion, it's facts that matter in the court. And one of the really interesting arguments that was laid out was that COVID itself is ubiquitous. It's something that's present. It's not a risk that is unique to workplaces. So, so think about that. If a person is living their life, they're going to work, or they're going to be doing any other thing in their life, that COVID is everywhere. This is not a workplace risk, or at least not for most professions, and they're kind of applying it across all types of the mandate itself across all types of jobs, or the set of rules on any industry over 100 employees. So I thought it was I came away from it feeling more confident that 5-4 or 6-3, that it would be that OSHA's authority would be struck down by the Supreme Court, maybe even in its entirety. But I guess we'll see.
And then if we look at the CMS rules for healthcare, are there similar insights there as well?
The second part of the hearing was focused on the Centers for Medicare and Medicaid, what they're saying is that as a condition of reimbursement, anybody who receives Medicare or Medicaid reimbursement, pretty much all healthcare providers, or vast majority of healthcare providers, if you receive this type of reimbursement, you must require vaccination of your employees. And in this case, there are 15 different statutes that govern each of these different types of providers. So you have one for nursing homes, you have one for hospitals, you have one for ambulatory services. Like, there's all these different statutes. And they really got into the nitty-gritty of which ones provide more explicit ability for, in this case, the director of the federal department to implement rules, and rules that say that because of that they're able to make these general health and safety, additional health and safety rules as a condition of reimbursement. And so in this case, it was less clear where the justices would land. Now there are three on either end that are very clear. It's kind of three in the middle that are less clear. So when it comes to Breyer and Kagan and Sotomayor, they're going to side with the government in both cases. Gorsuch, Alito, and Thomas, I think, are going to decide against the government on both cases. What I heard from Justice Barrett was this question about, she asked in this case that the government's attorney, what if I believed that the federal government had some authority under some of these statutes to mandate a vaccine, but didn't have the authority under other statutes? You wrote one big rule as my only choice to strike it all down, or can parts of it stand on its own? And lawyers hate to answer questions like this because they're kind of endorsing, essentially striking down part of what they're trying to defend. And what the lawyer said was that these provisions are severable. You could hold up part of it and strike down another part of it. And so I thought that type of a question was pretty revealing with Barrett in particular. And if that was the case, my guess is that at the end of the day, they'll have a portion of the CMS rule that is either narrowly upheld or narrowly defeated, and then portions of it found to be unconstitutional or in violation of statute. In other words, they didn't have statutory authority to do this, and they couldn't point to strong enough language in the statute. Same problem with OSHA, but with CMS, with the Centers for Medicare and Medicaid, they their case is clearly a little stronger there, just but not explicit enough, clearly not explicit enough to satisfy some of the judges or justices. So hopefully we'll know soon, but we have I think based on the line of questioning and what was broadcast overall by those justices with the questions that they're asking, there's pretty good chance that a lot of this is going to be curtailed on the OSHA side in a very substantial way.
Do you expect we'll have an answer, in a day, a week? What's the time frame we're looking at right now?
Well, there was a lot of talk about whether or not a stay would be issued, and the reason a stay is important is because there are portions of that rule that go into effect today. So technically, if you have more than 100 employees, and you have employees that are not vaccinated, as of today, they're supposed to be wearing masks. And so the question was, and then a month from now is when you'd have to require testing or vaccination as a condition of employment. So portions go into effect today. There was some talk about why not just do a stay, or what would be the harm in staying it for a couple days. They kept on saying a couple days. And that told me that they thought that it would take into the middle of this week to have a final decision written on this matter. I have no doubt that there's a lot of urgency with which they're dealing with this. If we were going to see a stay and then a decision, I kind of think we'd have seen the stay already. So I think they probably decided not to do that because they're going to, in very short order, issue a final decision. So that tells me we're going to hear this week, maybe as soon as between today and Wednesday. So I'm hopeful, kind of on the edge of my seat on this one. I really would love to have this issue settled, because our employers are dealing with more absenteeism today than they ever have, and the idea of losing any of the employment base is going to have a really big negative impact on businesses that are just struggling to keep their doors open right now.
Absolutely. Well, you all know we will keep you updated either via our email newsletter and then again on this briefing on Thursday. Brian, we launched a survey today. We've been doing quarterly surveys to gauge how our members are doing on a variety of different metrics. So tell the people listening why they should answer this survey. What do we do with this information, especially from a government relations perspective? We
started a year ago, or more than a year ago, doing they're quarterly now. I think before we weren't necessarily intentionally doing it every quarter; it just kind of worked out that way. But each quarter, what we want to do is check in with small businesses and see how they're doing with employment, with the challenges and issues they're facing, what's happening with your sales level and the number of employees that you have, overall costs, inflation. So we ask about several things, but it's a quick survey. You could go through it, in most cases, you probably go through it in just a couple of minutes. And we like to get hundreds of responses, and so that the results really mean something. And then what we do is we share them with the world, but also those that are making public policy decisions so that they can see, this question, how's small business doing? A lot of times they make people in public policy in elected office, they make the mistake of they'll look at the overall like unemployment rate, they'll look at the overall GDP, but how small businesses are doing is a different story underneath all that. So what we're trying to do is pull out that different story, good or bad, and share it with those public policymakers. Say, but here's how small businesses are doing, and this survey is a really important basis for us. So if you can, please do participate. Let us know how you're doing, and we'll use that insight to go back into the system and ensure that our public policymakers know exactly what the state of small businesses is.
Absolutely. So yep, the link for the survey is in the comment, both in Zoom and Facebook. So please take a few minutes to do that today. All right, that's all we have time for today. Thank you for joining us, and we will see you back here on Thursday at 3 p.m.
Thanks, everybody. See you on Thursday, hopefully with good news from the Supreme Court.